Latanoprost, also known as Iyuzeh 0.005% eye drops, is a medication used to lower high pressure inside the eye caused by conditions like glaucoma or ocular hypertension. It works by regulating the flow of fluid within the eye, which ultimately reduces the pressure inside the eye. By lowering high pressure, it helps to prevent blindness. It is typically used once a day in the evening, and it's important to follow the dosage instructions provided by your doctor. Taking it at the same time every day can help you remember to use it consistently. When using Iyuzeh 0.005% eye drops, it's important to follow your doctor's instructions. Typically, you'll apply the drops once daily in the evening. To avoid contamination, be sure to wash your hands before using the drops and do not touch the dropper tip or let it touch your eye or any other surface. If you wear contact lenses, remove them before using the eye drops and wait at least 15 minutes before putting them back in. Tilt your head back, look upward, and pull down the lower eyelid to make a pouch. Hold the dropper directly over your eye and place one drop into the pouch. Close your eyes and apply gentle pressure for 1 to 2 minutes to prevent the medication from draining out. Try not to blink or rub your eye. It's important to use this medication regularly at the same time each day to get the most benefit from it, even if you feel well. If you use other eye medications, be sure to wait at least 5 minutes before applying them after using Iyuzeh 0.005% eye drops. Use eye drops before eye ointments to allow the drops to enter the eye. Remember not to rinse the dropper and to replace the cap after each use. Side effects of using Iyuzeh 0.005% eye drops may include blurred vision, burning/stinging/itching/redness of the eye, feeling as if something is in the eye, changes in eyelash number/color/length/thickness, eyelid changes/skin darkening, dry eye, lid crusting/discomfort, or increased sensitivity to light. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist promptly. Over the long term, this medication may cause brown discoloration of the colored portion of the eye, iris. If you are using the eye drops in only one eye, only that iris may change color. This color change may be permanent, but the long-term effects are uncertain. It's important to notify your doctor if this occurs and schedule regular eye exams to monitor it. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, you should tell your doctor right away if you experience any serious side effects, such as eye pain, suspected eye infection, unusual redness or swelling of eyes, or rapid vision changes, such as loss of vision. A very serious allergic reaction to this drug is rare. However, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, severe itching/swelling, especially of the face/tongue/throat, dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Before using Iyuzeh 0.005% eye drops, talk to your doctor or pharmacist if you are allergic to it or have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have other eye problems, have had eye surgery, or if you develop an eye infection or injury while using this medication. Your doctor may advise you to start using a new bottle of Iyuzeh 0.005% eye drops. After applying this medication, your vision may become temporarily blurred or unstable. It's best to avoid activities that require clear vision, such as driving or using machinery, until your vision has stabilized. If you are pregnant, it's important to discuss with your doctor whether the benefits of using this medication outweigh the potential risks. Similarly, if you are breastfeeding, consult your doctor before using Iyuzeh 0.005% eye drops. When using Iyuzeh 0.005% eye drops, it's important to be aware of potential drug interactions. Certain medications or herbal products may affect how Iyuzeh works or increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Never start, stop, or change the dosage of any medication without your doctor's approval. One product that may interact with Iyuzeh is eyelash treatment, specifically topically applied by Latanoprost. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If this medicine is swallowed, it can be harmful and may cause serious symptoms like passing out or trouble breathing. In case of an overdose, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can call 1-800-222-1222 for your local poison control center, and in Canada, residents can call a provincial poison control center for assistance. It's important not to share this medication with anyone else. Make sure to get regular medical and lab tests, like eye exams, while using this medication. Remember to keep all your medical and lab appointments and consult your doctor for more information. If you forget to use the eye drops, use them as soon as you remember on the same day. If you don't remember until the next day, just skip the missed dose and continue with your regular dosing schedule. Do not use extra drops to make up for the missed dose. Remember to use the drops at the same time every day for the best results. When using Iyuzeh 0.005% eye drops, it's important to follow the storage instructions provided on the product package or by your pharmacist. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.